Hi, I'm Brianna Anthony, a family medicine doctor in Fort Collins, Colorado. I graduated residency in 2020 right here in Fort Collins. And after residency, I was excited to join a successful local practice that was physician-owned. But like many other private practices across the country, they were forced into being bought out by a corporation. I only lasted in corporate medicine for a couple of years, and I had to leave for my mental and physical health. I gave up primary care, at least for now, and started a new private practice, but I don't take insurance. The administrative burden of our insurance company is crushing. It's purposefully complicated so that rich corporations can make more money, not care for patients. Doctors and other healthcare providers hate their jobs right now because we're not able to take care of patients in that way. There were days when I would cry driving to work, and I know my colleagues and friends do as well. The moral injury is very real. Our corporate healthcare system is a nightmare. Over the past couple of years, physician burnout has improved from 62% down to 48%. That's half of our doctors. Healthcare providers are cutting down on hours or even leaving the profession, retiring early. Just about 80% of physicians are owned by corporations or private equity now, and 10% are owned by one corporation, United Healthcare. This means there is pressure to see more patients, have shorter appointments, upcode patient visits with the least amount of staff and nursing possible to make more money. That's the focus, not caring for patients. When healthcare is taken over by private equity and corporations, which is at high rates now, the goal is to make the employer and the shareholders as much profit as possible. We have a medical system where profit matters more than people. People are getting sicker, some are dying, and costs continue to increase. It's heartbreaking when you're sitting with someone who is just diagnosed with cancer or who lost their job and doesn't know how they'll pay for their child's asthma inhaler, and you have 15 minutes and 10 more patients to see, and insurance won't cover that medication, and the wait to see a specialist is 6 months, and you still have to review all of those lab results. Family medicine docs would need more than 24 hours to give appropriate care to a patient at this rate and get the administration and documentation done. It's impossible. Things are missed, care is delayed, patients get sicker, and people are frustrated. The whole experience and what is happening is truly heartbreaking. I made a change to save my mental and physical health so I could continue working for my patients, not a corporation. Things have to change. We can do better, and we need to do better. Thank you for being here, and thank you for listening to my story. We can do this. Healthcare is a human right, and together we can make that a reality.